My name is Zeb Elliott. I'm the Chief Technology Officer at UVA Health in Charlottesville, Virginia. We're an academic medical center with a community health environment as well. So we've got 3 community health hospitals. We support the School of Medicine as well as a large ambulatory footprint. One area that I would prioritize for the upcoming year for our infrastructure is building out our hybrid data center platform, expanding more into the cloud, and having a flexible environment is much better than having a rigid environment. And I think we need to make those investments to ensure that we have that scalability and flexibility into the future. I think transformation for us is getting the right technology in the right place at the right time and not overthinking it or making it complicated. We think about the new shiny toy and we forget about the underlying foundational technology that needs to be able to support that. So I would say transformation is incremental, right? Let's think about the small incremental things that we can do over and over and over again that leads to the bigger thing. And it's easier for our clinicians to adapt. It's easier for our patients to adapt. We're not throwing some big thing at them at one time, and it allows us to be successful. As a technology leader, I have to always be thinking about what I can do now versus what I can do later. I have to go with the pace of the business, right? What projects are needed for us to deliver now, and it's the organization that's going to dictate where I need to go and make the investments for the technology. That being said, I have to keep the lights blinking, right? I have to make sure the network stays up. I have to make sure the internet pipes are big enough. And those are things that we do every day. Those are a part of our normal jobs and our normal operations. The first thing I would say is build relationships, right? Focus on the relationships with your business partners and your team. Having some mentors developed within the organization who can guide you through the scenarios that you're going to face as a technology leader. The second and last thing I would say is focus on the reliability of the systems that you support. A CTO's bread and butter is reliability of the systems that they operate from day to day. The part of healthcare IT where stability matters more than innovation is the underlying network. Without it, nothing works. You have to make sure as a CTO you take care of the network. If the network works well, you work well. If it doesn't work well, you have a bad day. We talk too much about cybersecurity and not enough about cyber recovery, because everyone will tell you it's not a matter of if, it's a matter of when you're going to actually have an incident. We talk all the time about protecting the edge and protecting the network and protecting the endpoint. We don't talk enough about when that gets compromised, how are we going to actually fix it and recover from it.